My name is Catherine Adair. When I was 19 years old, I became pregnant. So I went into the abortion clinic, and the whole time I was there, all I was thinking was, please, somebody help me. I don't want to do this. They say that women feel relieved after abortion, and it's true. You do feel relieved. The decision-making process is over. It's done. You don't have to think about it anymore. But for me, I in that moment of waking up in the recovery room, I just felt so empty. I decided in that moment I was never going to talk about it. I was never going to think about it. And that's exactly what I did. I threw myself into this world of feminism that said what I did was okay. It was just a choice, that it was empowering. It was positive. I just thought, I'm going to be the world's greatest feminist, and that was really what I set out to do. If somebody called me a radical feminist, I probably would have liked it. I changed my major to women's studies at college. I marched on Washington for pro-choice. I really believed everything that feminism was telling me, that abortion rights or reproductive rights were about empowering women to make choices over their own bodies. So when I graduated from college, I saw that Planned Parenthood was hiring. And I thought, wow, this is great. And at first, all I did was, as patients came into the clinic, I simply checked them in. And the second job I was given was to take payment. And that's when I found out what we actually were doing in that clinic, that we did abortions all day, every day, because every single patient that was paying for an abortion. After I'd been doing that for a while, they said, well, we're going to train you as a counselor. So there were little things that were happening when I was a counselor that really bothered me. Young girls would come in, underage girls, with a man for an abortion who was much older than her, clearly not a parent. And they would know that he was her abuser, and they would say, well, we can't do anything about the abuse, but at least we can give her the abortion. And I just thought, gosh, that's not right. But yet I kind of thought, well, maybe they're right. Maybe they know better than I do. We were supposed to have parental consent for an underage abortion. But in these cases, basically the attitude was, well, we can't do anything about the abuse, but we can give her the abortion, because clearly this young girl's been impregnated by this older man. We never reported it. I never saw, there was never a form to fill out, or, you didn't have to report these things. So this poor girl is, given this abortion, then she's sent right back out with her abuser. I remember a woman in particular who came in, she was Somalian, and she came in with two men. One was her husband and one was somebody else, I don't know who. And they were allowed to come into the counseling room, which was very unusual, because one of their protocols was that the woman had to come in by herself so that you could make sure that she was making this decision on her own. She wasn't being pressured or forced into it. But because we didn't have a translator and she didn't speak English, they allowed these men to come into the room. He kept saying to me, just put her through. This is what she wants. And she wouldn't look up. She was just looking at the ground the whole time. She wouldn't look up. And so I got my manager and I said, I don't know what's going on here, but I can't be sure that this is her choice. And she came into the room and she talked to the husband and the uncle or brother, whoever it was, and they said, no, this is what she wants. And she said, well, just put her through. I just felt so helpless. I was angry and confused, because I thought, well, wait a minute, again, the protocol is to make sure that she's not being forced, but she won't even look up from the ground. I started, little chinks, I'm like, maybe it's not the feminist place that I thought it was. But I stayed. So after I'd been doing this counseling for a while, they trained me as a medical assistant. My job was to bring the patient into the procedure room, to get her ready for the doctor to come in, to hold her hand if she needed me to hold her hand, to make sure she didn't move during the abortion, to bring her to the recovery room, and to clean up the room after the abortion. And, this is when my eyes were really open to the doctor-patient relationship. It doesn't exist. Her feet are in stirrups. She's got a gown on, and that's when the doctor comes in. If she's lucky, maybe he'll make eye contact with her or use her name. Probably not. So I would get the patient ready on the table. The doctor comes in, and he would administer the local anesthetic. And then what he does is he uses metal rods to dilate the cervix, and he uses instruments to scrape the entire uterus. This is when oftentimes complications happen, because that's when you can perforate the uterus. After that is done, the doctor inserts a tube into the uterus, and that tube is connected to a jar, it's all part of a suction machine. And the nurse turns on the machine, and it takes everything out of the uterus. It goes through the tube and into a jar. And what I remember most is just the silence. After that machine is shut off, it's so quiet, and I always think of it sort of as the moment of death. The other part of my job was you had to take everything that was in that jar, and you put it through a strainer. Anything left in the uterus could cause a infection, so you have to find all the pieces. And so we would have to find the 2 arms and the 2 legs. Sometimes, you'd see a bit of a rib cage or a piece of the baby's skull. As horrifying as that sounds, I wasn't a bad person. We weren't these ghouls. There was a moment that really changed everything for me, and that was when I was asked to clean up the room after a second trimester abortion. Next to the table where the patient would have been lying was a jar. Inside that jar were the arms and legs of a baby. They were perfect. They looked human. They were just beautiful. And I don't know why it was different. I've always thought, maybe it was the size. Maybe it was, I really don't know. But I knew in that moment that everything had changed for me. You would think that I would have gone running out of the clinic and screaming and grabbing the first person I saw and saying, do you know what they're doing in there? But I didn't. I got up and went to work the next day, and the day after that, and the day after that, and the day after that, because my whole identity was this progressive feminist, this pro-choice feminist. We see it every day. They talk about clumps of cells, they talk about choices, they talk about reproductive rights, but nobody sees what's actually happening. It's completely hidden. So anybody who's, talking about clumps of cells argument, as hard as it is to believe that still exists, doesn't have to see ripped apart babies and abortions. So it's very easy to say it's not a human being when you don't have to see it. To really come to the realization that abortion was the taking of a human life was extremely hard for me. Maybe a month or 2 after that, I just stopped. I was like, I'm not coming here anymore, because I would just go in there so angry. I didn't want to betray, this sisterhood, this movement. I couldn't. So rather than betray it, I just buried it. Looking back, I can certainly link my depression, anxiety, to my own abortion and being in that environment and doing the kind of work that I was doing. But at the time, if I tried to say anything that against abortion, I was immediately shut down. Nobody wanted to hear, well, I think abortion hurts women, or my abortion hurt me. It was such a party line that you didn't dare to cross. And then I thought, well, isn't feminism about hearing everybody's voices? Isn't it about hearing women's voices? Isn't it about the feminine experience? And yet this is my experience, and I'm being told to shut up. The feminist movement has been hijacked by abortion to such an extreme extent that feminists are willing to bully women into silence. And I think that when you allow a corporation, which is what Planned Parenthood is, it's a corporation, to hijack your movement, then you've lost your movement. Planned Parenthood is responsible for about 30% of abortions every year in the country, which is about, I think, 336,000 every year. In Illinois, only 2.3% of women of childbearing age receive care at Planned Parenthood. Planned Parenthood doesn't provide any full spectrum care for anybody. And there is not one thing they provide that you can't get at your general practitioner. And in fact, in Illinois, not one Planned Parenthood has been inspected in the past 15 years. It really shows that abortion is so political that they're willing to actually put women's lives at risk by not inspecting these abortion clinics. When I think of the word empowering, I think of something positive and uplifting and something that gives you strength. There was not one woman that came into that abortion clinic who was empowered by abortion. There was not one woman who was helped by abortion. Women are not having abortions because they want to be empowered. They're having abortions because they're not getting the help that they need. If they could look into the eyes of women in the recovery room and see the deadness, the pain, the horror, they would never say that abortion is empowering. Educate yourself about fetal development, about abortion procedures, and to know what actually happens during an abortion. You also have to listen to the voices of women who have suffered because of abortion. It's easy to want to silence us, to want to say, that that's not true, that women aren't hurt by abortion, but women are hurt by abortion. And if you're going to call yourself a feminist, you have to be willing to listen to all women's voices, not just the women who agree with your point of view. We need to support women when they are experiencing unplanned pregnancies to help them with everything that they need. And whether she parents that child or she has an adoption plan and that child is adopted into a family, she knows that in the face of adversity, she did it. That's empowerment.